Hi, guys. So, this is your assessment, which is part of the professional practice course, and it's called Scope of Practice. Now, even though it's an essay, we still don't want you don't need to follow all the essay rules and regulations. And if you want to make it easier, we have got some headings we can provide you with, and the headings are basically the same as the rubric. In my headings, I have got the rubric a bit jumbled up, but it just goes a more logical flow. So this is what you're going to be actually answering. You're going to introduce what scope of practice means. You're going to define it, okay, and about where it comes from. You're going to describe a multidisciplinary team and how the team works. We're going to describe and explain why scope of practice is important within the team. Describe the scope of practice within a healthcare assistant and the similarities and differences between the healthcare assistant and the RN. So let me go to a template that I've made for you. You do not have to use, but it just might help you so you keep on track. Um, this is something you can actually do online, but being in class, you do more brains are better than just the one, and we hopefully will get some guest speakers in as well. Okay, so it 2 pages, two A4 pages max. It is a lot of writing. Keep your font 11 to 12, possibly about 11 on Calibra or Times Roman numeral. What does scope of practice mean? Just go to a definition about what it actually means and why is it important in the health industry. So a little bit of reading. There's lots of resources on Moodle, but it is something you can use the internet. So when you do find it through Ministry of Health or on the internet and you're going to define what scope of practice is and why it's important, make sure you put it in your own words. Do not copy and paste. Okay, so it needs to be in your own words. I also want you to put a small couple of sentences in there. First of all, what does the HPC Act stand for? So break those words down. Again, it's all on Moodle. What's it for as well? Why is it there? Why do we have it? So just a sentence on that, okay? So it's about housing all the regulations and all the registered health professionals to make sure they're doing it right. So, yeah, one paragraph, nice and small in your own words. Now, unlike the rubric, I have jumbled it around slightly. But it's okay, it doesn't matter, you're still answering the question. Describe what multidisciplinary teams mean. To get your head around this, multi means many, disciplinary means that you're trained in one particular discipline. You're trained or educated on one particular skill. Okay, so multidisciplinary in the healthcare is they're all trained to help somebody's needs, but one might be trained in dietitian, one might be trained in occupational therapy in-house needs, one might be trained as a doctor, and one might be trained as a registered nurse, one might be trained as a physiotherapist. But it takes all these teams, all these experts to help and support the client to get the best for the client. So what I want you to do is break down get some research. What does multidisciplinary teams mean? That's just be a sentence or so. And then just put a pretty good story in about how come or why and when they work together, keep them within the scope of practice, how do they actually support the client? So a little bit of information about that, about a paragraph. Now, what would be good, because we've used Rose's story, think about her story, rewatch a YouTube clip, actually list all the specialists, the multi-specialists that are aiding in her recovery. Okay, and how they all work well and support one another. So she has quite a lot of specialist teams on board to aid to get the best out of Rose's recovery. So maybe talk a little bit of an example about Rose's story, but still always go back to the question is describe what multidisciplinary teams is, explain how they work collaboratively. Right. Well done. You're doing good so far. Describe scope of practice as a HCA. Right now, as you know, and talked in class, we're unregulated. We don't have to carry out a registration. You could walk in off the street and get a role in a healthcare assistant. But there are certain principles that are developed that gives you a little bit of a scope of practice, which you do need. So there is an act called the Code of Rights, which is from the Health and Disabilities Commission, and there are 10 Code of Rights. Now, in class, we will give out these rights. You can find them online. And you'll notice that you actually do act on these code of rights for yourself and for the client. So it is something you fall back on, which is a professional body has done. So you are informing the client of what you are doing next. You are informing the client. So that's one code of right of the procedure that you are doing. Okay, and they have a right. And to be fair, you also can have the code of rights back on you. You should be rightly informed on what your job is and need to do. What else gives you your scope of practice? You have job descriptions. You have what's the other one? So there's job description, position, job position. That helps you, and also you are working under possibly a registered nurse, which does have a scope of practice. Okay, so these are how you find out your role. This, like your job description and your training on campus, gives you a define about how far, what you need to do within your role. And if you're not trained to do it and you haven't been trained to do it, well, really, that's out of your scope of practice, isn't it? So please just, what act might you follow? That could be the CODA, right? It's the Health and Disabilities Commission. Also, you gain education. This is why you're here on your level 4. And this helps you know what you can and can't do within your role. What are you trained to do? So you can take OBS and you can take blood pressure if your organization lets you and you feel confident to do so. List some roles you would do within your workplace and how you know how to complete your tasks safely and with keys. And that's to do with training, certificates, qualifications, in-house training. So yeah, I hope that I'm not talking too much and it's making sense. Then a very similar thing, you go on to describe a scope of practice for a registered nurse. Now, you know now they're under a governing body called the NZNO, and they have to be registered. So they do their 3-year training bachelor. They cannot go for their registration unless they have done a bachelor in registered nurse, a bachelor in nursing. Whereas you can't go and get registered if we've only done a level 4 certificate. So already there is a governing body that says, right, you have to get this registration, but to get this registration, you have to do a 3-year degree. Then once you got that registration, that has to be continued every single year. And to get that, you have to keep on training. It's every 4 years, I think the lady, every 4 times a year to keep up to date and to know that you are practicing safe techniques. So have a little bit of read on that at the Nursing Council and stuff, and how they actually distinguish a governing body to make sure that the registered nurse stay registers and how they're safe. And then do a little list on what does a registered nurse do that they have been trained to do that they can do independently. A little example is a care plan. They can write and assess a care plan. So they can assess a person and write a care plan. You, even though you actually have more eyes and ears than the registered nurse because you're with the person, you actually legally bind can't write a care plan and assess a client within an organization. Okay, you do all the keys for the person following the care plan. Although, of course, at home and in a home community and you're looking after family, it's slightly different. All right, what are the similarities and differences between a healthcare and a registered nurse? We did this in class. So what are the similarities? You both do personal cares. You could break that down and do what particular personal cares they do. You both look at emotional and health and well-being. So just go through the similarities first. But what is the differences? It could be the type of training that you've been through. It could be that one administers medication, one prescribes. I don't know, but we get through what can you do the same, and why is a healthcare assistant different to an RN in mainly what jobs they can and can't do, and why can an RN do one thing but not a HCA? So a little bullet points with a few examples and descriptions on why. Hope that makes sense. And then as a conclusion, this is actually only a small conclusion. This conclusion where you're just going to put in there why we have a scope of practice basically within the healthcare industry, and there are some ethics you can put in there for non-maleficent. You could even talk about how valuable a multidisciplinary team is. That's out there for the client, for the person-centered care, and why are acts there? Why are they important, and why should they be followed? Think about the consequences if they're not followed. It helps you answer why they're there in the first place. Don't forget where you're getting all this information from, okay? Feel free to ask questions. I hope I've made some sense here, and look forward to seeing it. Remember to Google it. Remember not to copy and paste. Yeah.